Welcome to the banker lamp. Please enjoy the video.
You begin by preparing the solution now. Wash your hands and clear the sink so nothing contaminates the cup. Pour 240 ml of lukewarm, distilled, or previously boiled water into the bottle because temperature affects comfort and safety. Then, add 1 premeasured NeilMed saline packet and shake until fully dissolved. This creates isotonic saline to match your nasal tissues. Once the powder is dissolved, place the cap on the bottle and test a small drop on your wrist to check temperature before moving to the sink. You lean over the sink and tilt your head about 45 degrees toward one shoulder so gravity guides the saline through the sinus passages. Insert the nozzle gently into the upper nostril, making a watertight seal without forcing it, and breathe through your mouth. This helps prevent swallowing or inhaling. Now squeeze the bottle in a steady flow. The saline will travel across the nasal cavity and drain from the opposite nostril. Once the flow slows, blow gently to clear remaining fluid and repeat on the other side. You finish by gently blowing each nostril to remove residual saline and mucus. Do not forcefully blow because that can push fluid into the ears. Then disassemble the bottle and tip. Rinse with distilled or boiled water and leave to air dry. This prevents contamination for the next use. If you experience stinging, altered taste, or ear fullness, make sure the water temperature is cooler, use a slightly reduced volume, and avoid tilting too far. If symptoms persist, stop and consult a healthcare professional.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.